One of the most common hormonal conditions in the world may have had the wrong name for decades. How, you might ask? Because many people with Polycystic Ovary Syndrome do not have ovarian cysts. This is certainly a misconception that I've had for my whole life up until the last week. I heard cystic ovaries and assumed that that must be the key defining factor of the condition. But oh boy, was I wrong. Polycystic Ovary Syndrome, or as it's now called, Polyendocrine Metabolic Ovarian Syndrome, or PMOS, is one of the most common hormonal syndromes on Earth, with at least 170 million women affected worldwide. Although, despite being so common, it does have a reputation for being very difficult to get diagnosed properly. Potentially as many as 70% of women affected by the condition are still undiagnosed. While I was editing this, I told some friends that this was the topic I was working on, and they got back to me, and this is clearly a very well-known issue when it comes to women's health. The long-standing misconception is that this was primarily a gynecological and ovarian condition. But in reality, hormones as diverse as insulin and androgens, that's the testosterone family of hormones, and also neuroendocrine hormones in the nervous system are involved. And yes, ovarian hormones too, hence the focus on the ovaries. However, the condition is a long-term and complex syndrome, characterized by hormonal fluctuations that can have impacts on weight and skin health, and also on the health of the reproductive system and the body's metabolism more broadly. It can even impact mental health, and more than that, the broad array of possible symptoms varies throughout a woman's life, from adolescence through later adulthood. But what's the major thing you don't need to have and still suffer from this condition? That's right, it's ovarian cysts. Research shows that there is no difference in the frequency of pathological ovarian cysts between sufferers and non-sufferers of the syndrome. While women diagnosed with the disease did have larger ovaries and significantly more ovarian follicles versus non-sufferers, there was no significant difference in the occurrence of any kind of ovarian cyst. The numbers in brackets here are percentages of women in each group, sufferers and non-sufferers, and these numbers are odds ratios. Basically how more or less likely one group is to have something than another. A ratio of 1 means equal odds, while less than 1 means a lower chance, and more than 1 means a greater chance. As you can see here, there is some difference in the odds for developing cysts, but none of them were big enough to be statistically significant. Essentially, the difference is small enough that we can't rule out the possibility of just random chance causing that difference. So the data show that the current name just doesn't capture the key features of the illness. And that's what's led us here. A collection of more than 50 patient and professional medical organisations have come together and worked to get the name of the disease changed. And you might be wondering, how much impact could just changing the name really have? And I'm going to let a true expert explain that to you. What we now know is that there is actually no increase in abnormal cysts on the ovary, and the diverse features of the condition were often unappreciated, said Professor Helena Teed, Director of the Monash University Centre for Health Research and Implementation, and the lead author of the research that led to this name change. It was heartbreaking to see the delayed diagnosis, limited awareness, and inadequate care afforded those affected by this neglected condition. My awareness was certainly limited, and misdiagnosis and neglect are a common thing that I hear about this condition and other similar ones, particularly those that affect women, and that is now backed up by hard data. By the way, those quotes came from an article published by the Endocrine Society that talks about all of this. I'll put a link for it down in the description. And for those of you out there who want even more detail, I'll also link the article published this week in The Lancet that made the case for changing the name of the condition and presented all of the evidence underneath it. I highly recommend it for a read if that's your thing, as this issue is very important. You might still be thinking, it's only a name, surely it can't affect the clinical setting that much. But names shape diagnosis. Both potential sufferers and the doctors treating them are primed to expect ovarian cysts, that don't need to be there at all for the condition to be present and, crucially, to cause symptoms. If a name points attention at the wrong thing, it may lead people to look in the wrong place for years, during which time they'll receive the wrong treatment, if any at all. As the Lancet article by Professor Teed and her colleagues puts it, confusion arising from the current name can delay diagnosis and hinder effective communication between patients and health professionals, contributing to patient dissatisfaction with care. In the face of mounting evidence, healthcare professionals are increasingly seeing the old name as outdated and even crossing into harmful for diagnosis. I've spent a long time hearing my female friends, and women more broadly, talk about how hard it can be to get taken seriously for conditions like polycystic ovary and others like endometriosis, for example. While it may seem like a small step, hopefully this renaming is the first step on the road towards fixing that. Thank you for taking the time to watch today. If you have any thoughts, please let me know down below, particularly if you have any first-hand experience with the newly renamed PMOS. There must be millions of untold stories out there, and sharing them is how we can keep building awareness and lead to meaningful change. So please, if you're comfortable, tell your stories. Thank you again for your time, and please don't forget to like, subscribe, and ring the bell for notifications for more in the future.